My name is Dr. Stephen Asimwe. I'm Program Director of the Global Health Collaborative, which is a collaboration between two academic giants and two big hospitals. In Uganda, it's Mbarara University of Science and Technology and Mbarara Regional Referral Hospital. And in the United States, it is Harvard University and Massachusetts General Hospital, or MGH. This collaboration is 18 years old and has grown to be a leading academic medical partnership that fosters health and well-being globally. And we do this through 5 main areas. One is academic support in the medical sciences, working with MUST to train the next generation of health leaders in medicine, in nursing, in the lab sciences and public health. We also do this through supporting affordable, locally tailored medical technologies through CAMTech. We hold annual innovation sprints where we nurture local talent and develop medical technologies that help our people. We also do this through supporting clinical care with several departments in the hospital, more notably critical care, oncology or cancer support, pathology, and many other areas in medicine and surgery. We also support community health initiatives because MUST is a premier institution for training the next generation of health care workers that meet the needs of our community members. So we support one of the largest community health programs for both medical education and also delivery of health care. So these programs are what comprises of the Global Health Collaborative that has been growing strong in research publication, in the quality of care that we offer, and also the quality of health professional that is produced in MUST, given that we leverage on the expertise of internationally recognized entities like Harvard and Massachusetts General Hospitals. Now, COVID has affected all of us. COVID as an infectious disease an infectious disease that can affect anybody and that has high mortality, has affected all of us. Definitely also the measures being taken, like the lockdown, has impacted on our programs, in the way we deliver our programs. But we have risen up to the challenge. And how have we mitigated this? 4 main things. The first is space, because we knew that when this disease came, it would take away all the intensive care beds that we had. And at the time the epidemic was beginning, there were only 10 beds in our hospital to take care of very sick patients. So we started very quickly working with MUST and the hospital to build a COVID treatment facility. This is a 44-bed facility that has been equipped with machines that can take care of very, very sick patients. This facility is now standing, and it has taken the efforts of very many people, Build Health International, the folks at Massachusetts General Hospital, some independent donors, some old boys associations, Mbarara Business Club, and many others that we have mobilized together to provide resources, and combining with the government of Uganda through the Ministry of Health. The COVID treatment center now stands and is just left with the oxygen treatment plant which we have also got a generous donation, and will be working to equip this facility with its own oxygen treatment plant, and it will be operational very soon. We have also gone ahead to rally our partners like Epicenter, the Church of Uganda, the Catholic Church, and other entities in and around the city of Mbarara to support the COVID treatment and prevention efforts locally. The other area that is key, even before this space is available, is medical staff. Because without nurses and doctors, then you have no facility. So the Global Health Collaborative, from the very beginning, supported our hospital here with medical staff, beginning with the volunteers to man all the gates entering the premises, screening for temperature, and also getting people to wash hands, to actually hiring staff on an emergency basis. 2 doctors, 6 nurses, 5 support staff, a lab technician, technologist, an IT person to manage the COVID patients that come in our facility. This is to supplement Ministry of Health and the regional referral hospital efforts in ensuring that these patients get the best care they can get. So we have a total of up to 20 people that are supported by us on a monthly basis to continue the efforts or build upon the efforts of the university and the hospital in taking care of our patients. Now, once you have the staff, they need things to use. So the Global Health Collaborative was the very first to support the hospital with the initial consignment of personal protective equipment, the medical gowns, the face shields, the gloves that the clinicians were able to use. We also later on provided more resources that bought a consignment of PPE that was used not only by the hospital but for the referring entities. Up to 30 of them received PPE. In this last second wave of COVID, MGH and the collaborative purchased more PPE that we were able to have the university and the hospital clinicians have and are currently using up to this point. The last and the final critical area was the purchase of equipment to fill the COVID treatment center, because once we built it, it was empty. It needs equipment. So we bought all the 44 beds. We bought the patient monitors. You know, patients who are very sick need intensive care monitoring. The screens, the bins, and all other equipment. This is brand new equipment that we procured locally from joint medical stores and a few other local entities. Amidst the second wave, when there were very acute shortages of staff, we mobilized physicians and clinicians from Massachusetts General Hospital. A team of about 8 clinicians flew in the country in the middle of the second wave. This is the Global Disaster Response Team that flew in here and spent up to 3 weeks supporting the hospital in caring for COVID patients. They conducted training of the doctors, training of the nurses, training of the support staff, and we were able to save many lives because we were able to use the techniques that are being used in world-renowned centers for COVID. Right now, we've just got support for a new program to advocate for COVID vaccinations, because we know prevention is better than cure. It doesn't help us to build a center and have many patients coming. So we want to advocate for the equitable access of COVID vaccines that anyone who needs a vaccine should get it. Our children, our students, as you know, in the education sector have been greatly impacted. Many post-secondary and primary students are still at home. We need to get them being educated. The future generation of doctors and nurses is among those people, and we will not get to that unless we get vaccines. So this is a new program that we will be working with a local civil society organization in the country, as long as MUST and other academic and advocacy entities in the country, to make sure that we get more vaccines for our ministry and our hospital to use.